So if you're having brain fog, so let's go back when you retired for a minute, because we can move back and forward in time for testing. If we just test for you then, I want to be healthy, I want to be sick. Okay, well, you're reversed. So let's hold the belly. So just for testing, I want to be healthy, I want to be sick. When you're retired, and this has something to do with my clients, dopamine, I want to be healthy, dopamine, I want to be sick. Okay, so that neurotransmitter was reversed. There's your brain fog. If we check epinephrine, I want to be healthy, epinephrine, I want to be sick. If I check serotonin, I want to be healthy, serotonin, I want to be sick. So because of the fungal issues, the hidden viral fields, the parasites, all of which MS clears, okay, your neurotransmitters, your body was using them as a toxin. It couldn't even use them.
Right.
That's what happened. So absolutely. The MMS raised your frequency because it cleared out all those lower frequencies of pathogens. And that allows for that spiritual connection. Yeah.
I know when I retired, I had 3 different urologists had me on antibiotics totally for close to 2 years, continually for close to 2 years, and I think that contributed a lot to it. And now that I understand the fungal issues and what we were talking about earlier today, looking at your client load, you're running 75–80% of your clients all have partial or all of their problems are fungal related. And that coincides with what Dr. Humiston told me, that he feels 70–80% of his patient load has fungal issues, and it's an underlying cause of their health issue. So anything we can do to help control that fungus has got to help in many ways.
In our society today, if you're 40, 45 at the latest, and never have been treated effectively for a fungal infection, you have one. The reason that most Americans 20 or 65 and older are on like 9 or 12 medications, they're all chasing the tail end of a fungal infection. Lipitor for this, or Pepsid AC for that, or sleep medication, and it's really because the fungal infection's never been adequately addressed in Western medicine.
Makes sense to me. Okay, you might want to tell people what you can do to help them identify that and things that you might be able to offer if people call you.
Yeah, we're very adept at testing, like we've demonstrated, showing you what level of gluten and lactose you can have or not have. I would say most of my clients that call, they'll do the diet, they do our treatment, which is reading a series of acupressure points that's unique to them for that issue. Okay, I put them on almost always MMS first, unless they can't. There's very few people that can't. And then we use the silver. And then I put them on 2 or 3 probiotics that I would take one day, one the next. I would say 85% of my clients get their foods back in 6 weeks and show a gluten-free, and usually the fungal infection's down to less than 3%.
Wow, that's great.
That quick. Before MMS, and I was using some other good products, Candex, grapefruit seed extract, I would have people that would have fungal infections 9–10 months. And it gets pretty hard for them to want to stay on a diet that's that restrictive for a year, 2 years, when they're not seeing big changes.
Right.
So, that and the dental issues, because again, my population with compromised immune systems, they can't go see the dentist. They've got terrible teeth. Being able to use MMS and stop that infection has really been life-changing for hundreds of our clients.
Yeah. So. And I've had about 25,000 customers so far now, and we've got 15,000 subscribed to our weekly newsletter. And so I want to put links to this video.
Sure.
We're going to put the video on YouTube and put links to it, so we'll be able to hopefully drive some more people to your website.
Good.
And you might want to mention that too.
Yeah, our website is quantumtechniques.com, and there are free manuals, there are free teaching how to self-test. We have about 10 hours of free DVDs you can listen to, MP3 downloads you can listen to on your computer about getting over blocks, if you have a block to testing. And then we have multiple practitioners. You can download a free manual, and then if you think it's worthwhile, you can actually buy the manual for $25, and that's a way of trying it out, and you can choose a practitioner and get a free 20-minute session. You get a lot done in 20 minutes in our work.
Yeah.
So we have a lot of things there for people that they can take and work with, and then if they need our help, we're there.
Right. I know I said when we started that I've watched people demonstrate kinesiology for 20, 25 years now, and I've piddled around about it, but I'm blown away with what you're able to accomplish now quick. I've never seen anybody move so fast in my life, and I'm like, whoa. It took me a long time to understand it, and I really appreciate you taking the time to personally show me exactly the things I've been missing. So I really have a lot of confidence in you and my own ability now to test myself, and I'm hoping this tape will be beneficial to a lot of other people in the same way.
One of the things we have on our website is we want to teach you to heal yourself. So we actually record the sessions, send it to you in a compressed file, and I try to teach people who can muscle test how to do everything that I'm working with them on the phone, so they can then be independent in their own best healing.
Yeah. I know it's I would say from what little bit I've been in here, but I mean, it seems like you usually don't spend more than 10 or 15 minutes with somebody, and you can make a real difference in their life because they have instant access to knowledge that if they could spend 10 times as much going to laboratories and probably get 1/10 of the information, because the laboratories, they're for the most part, they're just counting dead cells and sending back a report that really doesn't tell you what needs to be done to correct the issue, whereas you guys have specifics on how to correct that. All right, well, thank you very much, Stephen. I really appreciate your time and everything. Thank you.